Welcome everyone to another edition of the Massage Therapy Foundation and the National Certification Board of Therapeutic Massage and Bodywork webinars. Today we're going to venture into the topic of sports massage, and what a perfect time of year to be exploring this topic together. And joining me today are two of our best experts in this field. I'll have you introduce yourselves, Dolly and Portia.
Hi, I'm Dolly Wallace. I am the current president of the National Certification Board for Therapeutic Massage and Bodywork. Portia.
Hi, I'm Dr. Portia Resnick. I'm a former president of NCBTMB, as well as a current trustee for the Massage Therapy Foundation.
And of course, I'm Robin Anderson. I am the president of the Massage Therapy Foundation, and I have been a practicing massage therapist and an educator for the last 16 plus years. So with that, let's go ahead and get started. First off, we want to thank our sponsor for today, Handspring Publishing, who at the end of this broadcast, they have a special offer for you, so stay tuned for it, but we're thankful to have them sponsor us today.
Just a brief introduction to NCBTMB. We're a nonprofit organization, and our mission is elevating the massage therapy profession nationwide by establishing and advancing the highest credentials and standards of excellence. Our programs are board certification in therapeutic massage and bodywork, also approved providers for continuing education, and specialty certificates. For more information, you can visit our website at www.ncbtmb.org. I'm sorry.
And so the Massage Therapy Foundation is also a nonprofit organization, but our focus, our mission is to give back to the profession through means of scientific research, education, and community service. So we have many different ways in which we do that. One is through research projects. We also sponsor and have research conferences. Matter of fact, we have one coming up next year, so stay tuned for that. Educational programs on research literacy, webinars such as this, community service grants, and other contacts and other support systems for students and practitioners. For more information about our organization, visit massagetherapyfoundation.org. Also, the Massage Therapy Foundation supports and designates the official journal of our organization, as well as the Registered Massage Therapists Association of British Columbia, or RMTBC, is the International Journal of Therapeutic Massage and Bodywork, or as we all know it as IJTMB. It's free, open access, peer-reviewed, and PubMed indexed. You can find it by going to ijtmb.org. So one of the things that we're very thankful for is our collaboration with the NCB in these webinars that we present, since both of our organizations are very much committed to helping and advancing the standards of the profession. So we like to provide this information to therapists like you and educators like you, so that way it helps enrich your understanding of research. And today, while we all talk a lot about sports massage, we wanted to see how the research applied to massage, sports massage, and no better person to do that than our very own Dr. Portia Resnick.
So you can earn 1 CE today, and it's absolutely free because MTF is an NCBTMB approved provider, and we offer this opportunity. It's so exciting. And for details on how to get that CE, wait until the end of the presentation and we'll provide it at the end of our broadcast. So thank you for attending, and we're really excited to hear from Portia. And can you ask questions during this presentations? We ask that you please ask them in our chat box, and then we'll have a few minutes at the end of the webinar to address those questions.
All right, so let's get started and let's look at that research in sports massage. Let's get evidence informed on this type of practice approach. Take it away, Miss Portia.
Well, thank you so much. So those of you who have been with us for quite a few of our webinars, this research pyramid on the side is going to look very, very familiar to you. And in previous webinars, we've talked about this research pyramid. We've talked about what goes into a research article. And so when I was coming up with this webinar, I decided to use this research pyramid in order to create my presentation. And that's why we're calling it an evidence-informed practice. So to kind of start at the bottom, when I thought about sports massage, I thought, okay, you've got, over 25 years of experience in athletics, Portia. What do you think people need to know? So we started with that blue base, the anecdotal findings, opinions, ideas, things that I think you as practitioners really need to hear. And then I took a look at the literature. And I did my best to pull articles from all of the different layers of literature. So if you notice on the side, you do have a link to the handouts, which is going to show this webinar as well as give you all of my references at the end. And you'll note there's case reports, there's randomized control trials, and the top of our pyramid, there are a few systematic reviews and even a meta-analysis. And so with a meta-analysis, if you're not familiar, they actually take the results from multiple studies and they combine them into one big study so that we can get more statistical power from that. And we'll talk about that a little bit later on. I'll try not to bore anybody with statistics talk. So in building this particular webinar, I really looked at this evidence-based approach because it's not about picking out one article and saying this article says this is what we do. It's about looking at all the research. So let's dive into this research. And first of all, when we talk about sports massage, if you're here thinking you're going to learn sports massage techniques or what's the best technique for sports massage, you're in the wrong place. First of all, it's a webinar. I don't have my hands on anybody, so we can't really do a technique class. But as well, sports massage is not so much at one particular technique, but it's what you already know as a clinician and how you apply that to, in this case, an athlete. Some important things to keep in mind: you don't need to be an expert in a sport. And I always pick baseball for my example because I don't know a ton about baseball, about pitching mechanics. I know throwing mechanics and I know the anatomy of the shoulder really, really well. And I know some great techniques to help the shoulder. I don't need to know the pitching mechanics. I can learn that from the person who's going to be on my table or from a pitching coach. I just need to know my own area. So if you're thinking about getting into sports massage, don't think you have to be an expert in the sport. You just have to be a good clinician. You just have to know the questions to ask. And this is the one time I'll give you permission to use Google instead of Google Scholar to find your information, because that might help you a little bit. Some other important things to know, and we'll talk about this throughout the webinar, is to understand training and training cycles. It's important to understand that exercise is not doing the same thing over and over again. You really have to stress the body in order to promote growth. So there's going to be harder times during a training schedule. There's going to be easier times during a training schedule, and it's important to understand that. It's also important to understand competition schedules. For example, if we go back to baseball, baseball players may play almost every day, but pitchers are going to pitch about every 5 days. So kind of knowing when are their on days and their off days, it's really going to help us.
So Portia, since you're talking about training cycles and training about different types of athletes, can we use our Runners for Research for the Massage Therapy Foundation as examples?
Our runners are a great example for sports massage. And the reason is because they're training for a marathon, and they've been at it for a little bit longer because of COVID and because of some of the delays. But in general, a marathon training schedule is going to be about 20 weeks, about 4 to 5 months. And during that 4 to 5 months, they're definitely going to have weeks where they're really amping up their training. They're going to be doing a lot of miles. They're going to increase their intensity. They're going to have some really long runs. And those times really lend themselves to a good time to get a training massage. They're also going to have some easier weeks where maybe they drop down that intensity or their miles to help them recover. And that's also a good time to get a massage. Right now, we're within that 2-week taper window before the actual massage. So we're kind of in that pre-race window. Now that pre-race could be right before they compete, but really this is a good window anytime in these 2 weeks to consider a pre-race massage. And then as far as your post-race massage, again, that can start the minute they cross the finish line. Just keep in mind that they're going to be dehydrated and probably glycogen depleted. So our massage is going to have to be a little different. Everything's going to hurt. But that post-race massage can even last into a week or 2 weeks post-race because it's going to take them quite a few weeks to recover, especially if they're running their first marathon. And yes, we have people running their first marathon just for us.
Yes, we do.
So let's talk about some things about massage, and especially related to performance. There's a lot of research out there, and just so you know a little more, my area of research is recovery from exercise. And so we look at a lot of these recovery modalities: ice, heat, kinesio tape, foam rolling, lots of different things. And many times when they do this research, they use performance as outcome measures. And what they do is they put people through a maximum exercise, like a maximum vertical jump or something, an anaerobic exercise we call a Wingate test. It's torture. And then they apply this recovery technique and then see if they can repeat this maximal effort. And here's the thing, massage, like a lot of these other modalities, do not increase performance. They do not help you run faster, jump higher. They're not there for performance. They're really there for recovery. So this type of research, while it's good, it's not really the best way to evaluate massage. So always keep in mind what massage can't do. But what does the current research say about what massage can do? And I broke this down a little bit into short-term as well as long-term effects. And when we talk about some of these short-term effects, we've got ones that are objective, ones where we can collect raw data we can't really argue with. So when we talk about range of motion, that could be goniometry measurements or inclinometer measurements. These are things that are a little bit more on the scientific realm. You may not necessarily take these measurements after every single person gets on your table, but that's okay. That's what us researchers are here for. And objectively, it also reduces the effect of delayed onset muscle soreness. The measures that we also really care about as clinicians, and that's the clinician side of me, I always say I'm more of a field rat than a lab rat, is actually the subjective information. And these are questions you can always ask your patients, your clients, when they get off the table. How do they feel? And that actual feeling of recovery, even if we don't get the objective physiological measures that we're looking for in research, we still will find people have an improved feeling of recovery and they feel as though that fatigue is reduced. So these are subjective measures, but they're still just as important in our field. And about the long-term effects, here's what I found, which is kind of interesting, and please don't take these as negative. There's no conclusive results that massage lasts over a long period of time. Well, that just means our clients need to keep coming back. Massage is only going to last for a certain window, and I think we know that feeling. We know when it's time to get back on the table again. There's also no conclusive results that the effects are cumulative, and some people might be a little hesitant at that and think, well, but my person always feels like they're getting better. Yes, it's not that they don't feel that. It's just, again, from that research standpoint, we can't come up with anything conclusive that says that the results of every single massage are going to build on one another. So this is a research-based fact as opposed to kind of that anecdotal evidence, which we do rely on quite a bit. So always keep that in mind with the research. And again, it's just not conclusive. They're not saying it doesn't happen, but we don't have that statistical power behind it. One of the other things that's really hard with massage is it's really hard to compare studies, just like it's really hard to compare massage sessions. We as therapists don't follow a strict protocol. I remember, and many of you probably do, being a student and first learning Swedish was the first modality that I learned, and it was like 5 effleurages. Nobody does that anymore as you're practicing. You kind of work a little bit more on instinct. But when we talk about research, we really have to have set protocols. So the set protocols from research don't always translate into clinical practice, which also makes it very, very different. And again, not all studies focus on the same time and protocol. It's really hard to say, oh, I'm going to do an hour massage as a researcher and then try to get that to translate, especially over the number of participants you'd need to have in that research study.
So one of the things that's definitely come up in the realm of sports today has to do with stress levels. I'm sure many of you who watched the Olympics over the summer noticing how Simone Biles handled the stress, a lot of the swimmers under a lot of pressure. I have to mention Chase Kalish from Bel Air, Maryland, which is, I'm from Baltimore, so I want to just give a shout out to him. But anyway, but the point is that those athletes are really under a lot of stress. So Portia, can you give us some more insight on how that's helpful in terms of massage and stress levels as athletes?
Absolutely. And when we talk about stress, we talk about the sympathetic versus the parasympathetic nervous systems and that autonomic nervous system. And I think when people teach it on a basic level, they teach it as though we're always either parasympathetic, we're in that rest and digest, or we're sympathetic, we're in that fight or flight. And the reality is, especially with exercise, we really have this modulation between the two. So we're never really one or the other. It's just which one is a little bit more dominant. And the other thing to keep in mind, and I do love my autonomic nervous system research, is that there's no difference in the body's response between physical stress and emotional stress. So when we talk about these athletes and we're like, but they're highly trained at physical specimens, yes, but they still have some of that emotional stress. And the body can't really tell the difference in its response.
So they don't know the difference between a touchdown or somebody crying at a movie. They don't know the difference. It's still stress either way.
And I always use that, like, especially with doing like big presentations like this, like my body doesn't know if I'm on my run from this morning or if I've got hundreds of people listening to me do a live webinar. It doesn't know. It's still the same response. So we always have to keep that in mind. But what do we know about massage? And we do know that massage has an effect on that parasympathetic activity. Physiologically, we'll see decrease in our hormonal measures, cortisol, epinephrine, norepinephrine. Now, these measures are taken in a lab. Sometimes cortisol is salivary, but typically we'll get blood draws to get these measures. So this is not something that I'm going to look at in my clinical practice. From a clinical practice perspective, we can look at some of the other physical measures, heart rate, blood pressure, and then my favorite, heart rate variability, which is the variation in interbeat intervals. And we always think the heart should beat steady like a drum, but the reality is the more variable our heartbeat is, the more parasympathetic we are. So the higher the heart rate variability, the more parasympathetic. That's really a good thing. And massage can really affect these particular levels. Some things to keep in mind, most of these levels are found pre-massage to post-massage. So they take the level, do the intervention, the massage, and then take the level again. It's not necessarily taken over time. So there's no proof that my cortisol levels are going to stay down for weeks and weeks on end following one massage. Again, things we already kind of know. There is no dose effect where we can say exactly how many massage treatments it's going to take. And some of that is because, as we all know, between massage sessions, life happens. I review a lot of the case reports for the foundation, and always do we see people who will start to see measures go down, and then all of a sudden something in life happens and things pop back up. That's just the normal course of life, just like that kind of normal training cycle. So really keep that in mind, that those things might happen and we can't really change that. But the good thing is that the results are repeatable from session to session. So that's a good thing. Let's keep bringing those clients back. Let's keep putting them on our table. Also, always keep in mind that not all results can be generalized to every single person in every situation.
Well, plus different athletes, different situations, right?
And different responses and different areas where they are even within their training cycle. Like, for example, our marathon runners, they may, in the middle of their training cycle, have done a half marathon as part of their training. And, you know, that's not the same as the person who's training for a half marathon, and that's where they're trying to peak. So there are some different things that we're going to see along the way.
Portia, in my experience working with athletes, sometimes they don't really want a pre-event massage, especially if it's right before the event. Other times, other athletes, it's like, yes, we need that. So can you talk about some of the pre-event massage and some of the research for that?
Absolutely. So I found this article that kind of is talking about pre-event, pre-competition massage, and I actually had to pull up the title of it because I want to try and get this correctly. Let's see how well I trip over these words. But it's Effects of Massage Protocol, Intensomyographic and Myotonometric Properties. It's a mouthful. But basically what they're looking at is the response of the muscles on a physiological basis to massage. And so what they found was that contraction time actually decreased, tone decreased, and stiffness decreased after a massage, which in general for massage are good things, but they're claiming this as a pre-competition, pre-event massage, and they're saying that by decreasing these levels, it could potentially increase injury risk, that the person's not going to perform quite as well. And so this is where you always have to use caution in when you are looking at the particular research. And while it's a good article, I'm going to criticize it a little bit, is first of all, their protocol was about 5 minutes of effleurage, petrissage, some tapotement, some vibration massage, back to petrissage, back to effleurage. And they just focused on gastroc, I believe. Gastroc and soleus for this. They did have, it was manual therapy, so they did have a therapist working on them. They took the measures before, they did the massage, and then they took the measures right after. But there was actually no competition. And as we just talked about, the actual stress involved with competition is going to change some things within the body. As we get ready to compete, we're going to start to have withdrawal of that parasympathetic nervous system. Sympathetic nervous system is going to kick in, but this wasn't happening in this lab. So while they called it a pre-competition massage, and they said, well, you should use pre-competition massage with a little bit of caution, there was never actually a competition. And they never actually took any other measures. And I don't know about your experience, Dolly, but I've never had somebody get off my massage table and then go right out and compete. Is that what you found?
Right, exactly. They do not want to compete. They cannot compete right after.
So they're gonna have some time. There's gonna be a little bit of lag. What I do really like about this study, though, is it tells us a lot of things that we think are happening with massage. It does prove that we can decrease that contraction time, the tone, the stiffness, that somebody's going to feel better. So I actually like this as more of a post-event type of massage protocol than I do as a pre-event. But it's the evidence, so we have to look at it and we have to be critical of it.
Portia, one question on that. As we were just talking about stress of events, do you think that may be the sort of the outlier in this particular study? Because to be perfectly honest, if they don't have that stress of the event, maybe that's the reason why their muscles contracted, the tone was as such, and the stiffness was as such. Because in the body's mindset of stress, it wasn't there. So I mean, and you certainly wouldn't want to decrease contraction, because if you're going into event, what you want is your muscles to perform. So that would be the last thing that you want to happen. So yeah, I'm glad that you pointed out sort of the holes in this this study. And it's important for people to understand that, yes, not all research is perfect.
No, and you can't always take what the researchers say, because again, they're not the clinicians. As a researcher, I love this paper, I love this protocol. As a clinician, I see a lot of flaws in it.
Yeah.
So talking about massage and recovery, and again, recovery is really my area of expertise, and what I love about it is I really play a lot in the gray with recovery. There's not one metric that tells us that somebody is recovered. There's a lot of different things that go into it. In particular, like I said, I examine more of the sympathetic versus parasympathetic responses to that. So when we talk about massage and recovery, there's a lot of different things that go into it. Some of my concerns as well with the research is many times, again, it's done with a maximal exercise massage, and then another maximal exercise. And really, as a sports massage clinician, I want to use massage as part of the recovery throughout the entire training process. And that's really, that type of research is really going to have to come with more of a cohort type study where we're actually following someone a little bit better over time through their natural cycle as to how they're training. So talking about what the research does say, it's very difficult to compare across studies. There's a lot of differences, whether it's the type of massage that they're using, whether it's the timing of the massage, meaning the timing either before or after an event, whether it's the timing of the actual massage protocol, what protocol they're using. There's so many different things that just make it difficult to compare from study to study to study, which is why we use all of the evidence when we're creating this. Also, massage is often used with other methods of recovery, and that's not a bad thing. Many people use, for example, like the Normatec, the pneumatic compression. Sometimes people use like the Theraguns, the vibrational massage, cupping, instrument-assisted soft tissue mobilization, ice baths. There's so many different things that people can use that we can't just isolate massage, which is also really not a bad thing because there are a lot of different things that really can contribute and have their say. But things that we do know is some potential for both physical and psychological implications. And when we talk about that biopsychosocial model of healthcare, we want the biology, right? We want the psychology, the head in there, but we also want that social aspect. And one of the things I think we can all admit as massage therapists, that whole touch and just putting our hands on someone, there's really no way that we can kind of adjust for that. So what do we find? Parasympathetic modulation is going to increase. So they're going to be predominantly parasympathetic. Blood flow and lymph flow are going to increase while biomarkers associated with inflammation are going to decrease. All good things we're going to look for, and especially that psychosocial response is going to be positive. So there are subjective measures are really going to be positive. They're really going to give us some good results. This is definitely an area for us to continue to explore, whether we do it through the foundation or you do it in your own practice, or I try to do it a little bit more with some research in my lab. It's definitely an area worth exploring. All right, so what about performance and recovery with massage? So this is where I'm getting into a meta-analysis, and I'm going to again try not to put anybody to sleep with talk about statistics. But when we talk about a meta-analysis, because we're combining different studies, we have this concept of the effect size, which basically is like, how much of a dose do you need, and then how much does that actually cause change? And really, depending on what type of statistician you talk about, whether or not a research is statistically significant, while that's important, it's also really, really important to understand if it has some substantial value to the person who's actually getting that treatment. So what we find is that the shorter duration, it has a larger effect size. So while even if it's not, again, statistically significant, that p-value, when you're reading that results section, you may see that the effect size is large. And that's really, really going to be a good thing for us to kind of know and to kind of understand a little bit, that it has value. So when we're looking at that shorter duration, they're looking at that shorter duration being either 5 to 6 or 8 to 12 minutes. And again, this is a meta-analysis. So it looked at different studies with different protocols, and it found that those areas are kind of the sweet spot for a larger effect size. But here's the thing, this was not talking about doing a full body massage and the effects of a full body massage. They're talking about a particular area. And so if we think again from a clinician perspective, spending 5 to 6 minutes on a particular area, or even 8 to 12 minutes if it's a larger area, that's really kind of what we do already intrinsically. So really keeping that in mind. It's not like somebody's going to come in and say, you know, I want a full body massage in 30 minutes. that's not necessarily going to get those same changes. Just as if they said, I want you to just work on one leg for 45 minutes, right? That's not necessarily going to give us those changes, but looking at each individual area. And as far as longer duration, the effects were either unclear or negligible. So unclear meaning we didn't see a strong effect size, or it just wasn't quite as much. So there's definitely a balance. And again, some of that goes back to our own therapeutic intuition. When I read that, I was like, that makes perfect sense to me. So think about that. When we're looking at these studies and they're doing the massage and then they're giving a post-test, they found that the most effective, the best results were found closer to finishing that massage. So that shorter recovery window. So if they asked me 20 minutes after a massage, I was more likely to be happy than if they asked me 2 hours or 48 hours after a massage. Again, things that we kind of know, because there's a lot of things that can happen in those other windows that may affect how we're feeling. And then again, getting back to our endurance athletes or marathon runners, they also found that large effect size, as did our sprinters. So people who fell kind of somewhere in the middle, and I'm going to use, for example, like a soccer player who's probably not as much of an endurance athlete, does some sprinting here and there, maybe it wasn't as effective for them. But again, this comes from a meta-analysis, so we're not really sure always what the training is for each individual person. But the thing to always keep in mind, because we are very patient-centered, client-centered, that's really what this is about, there's this concept that's the smallest worthwhile change. How much do we actually need for that individual person to feel better? And here's where a lot of you clinicians are probably like, yes, maybe the research doesn't say that I had this big effect size, but I know that I affected that one person. And that's really what's important. We do change people's lives one massage at a time. So every time we put someone on the table, they're going to feel better. And that's really going to be relevant to them. And that's what's more relevant to us as a clinician. Not as relevant as to a researcher, but more relevant to us.
So how does this all translate to specifically to sports massage?
Well, again, we want to continue to consider our client and patient goals for that particular treatment. What do they want to accomplish, and what do they want to get out of what we're doing? And it always goes back to asking them questions and really not making that assumption, which is why there's always going to be so much research to comb through, and the answer is always going to be, it depends, right? So it depends as far as how we're going to use it. What are our goals? What's their treatment plan? What's their training plan looking like? Where are they in their training plan? What are we hoping to accomplish? And again, I'm just touching on sports massage in general. I'm not touching on anything related to injuries or anything related to any specific type of person. We're really just looking at this from a general perspective. And some other things for us to always keep in mind with this research, there's never any consistency in the type of research. They typically tend to say massage overall. Like I said, this pre-event massage, they were using massage cream and effleurage and petrissage and depotment. And I don't know that those would be the first things that I would think about for using, especially in pre-event, because I hear that effleurage and I automatically think Swedish and I automatically think parasympathetic. And again, we really kind of got those results based on what they were coming up with. Whereas for a pre-event, I might think as a clinician, maybe more of a myofascial technique or more of like almost like an active release type technique, because it's going to get that engagement and that involvement of the muscle. So really, really keep that in mind. Keep your own therapies in mind. Keep in mind your own techniques in the foundation of your practice. Also understand that a lot of us like to talk about different things that can happen with massage. If we are talking about changes in hormonal levels, it's really tough to generalize those without using pre and post measurements. So always be cautious of saying, I'm going to decrease your cortisol levels, because we really don't know that without having that proof. And that's well beyond the scope of what we can do. In my case, it's even a little bit beyond the scope of my research interests, but I'll gladly come along with a physiologist who wants to analyze that data. And always keeping in mind that research has to follow strict protocols. That's especially when we're talking about those randomized controlled trials. We have to follow these protocols. As massage therapists, we hate that concept. We hate the idea that we have to follow a strict protocol. We want to, again, go back to our client and patient goals, and those change over time.
Oh, Portia, it's so important what you said about the client goals, because as a clinician therapist, we think if somebody comes with a shoulder injury, oh yeah, I know how to treat that. But we really need key communication, where they're at in their training, when their event is, how hard they've trained, when their training schedule is. All that, communication is so important. We have to listen to that client, and you stress that a lot. So thank you for that.
So, Portia, we've sort of touched a little bit on this, but how can our listeners, how can our viewers actually apply this to their clinical practice? So can we give them a few pointers or tips and structure of how to go about doing this?
Okay. And first of all, again, never forget your foundation, the clinical knowledge you have. And this goes well beyond even your education. For those of you who are new to massage, who are out here who are just starting out in this world, good for you. But what you learn in school, you always need to continue to advance. I remember being told this as a student and telling my own students, the more people that you can work on, the more hands you can get or more bodies you can get your hands on, the better off you absolutely are. And that's true. Take that clinical knowledge. You are the clinician, you know this, but take it and really match it with the evidence. I know, and I think both of you ladies would agree, there's things that I learned in school that really aren't true anymore. Would you both say that?
Yeah, absolutely.
That's one of the things I always say at the beginning of teaching anything about research. Everything that I'm going to tell you today could potentially be irrelevant in the next 5 to 10 years. So what I'm teaching you now will not be supported by research. And they all look and scratch their heads and they're like, so then why am I taking this class? Because this is what we know now. And when research develops, it's up to us to follow through with it and to stay on top of it. So, and I would assume that's what you would recommend.
Absolutely. Be prepared to change when the research changes. And that's the thing about science, is it's always going to continue to change. We're always going to work to get better. And that's what the foundation is really here for, to help us and to support us as we grow and as the research keeps coming out. So maybe in 5 years, Robin, we'll revisit this webinar. Dolly, are you in for that too? And we can see how the research changed in 5. Somebody's going to put that on a calendar, and I'm going to be back.
You're probably right.
2026, I'm going to get a phone call like, hey, Portia, you said you were coming back. Yeah, absolutely. Continue to educate yourself. Continue all of the good continuing education that's available. Take advantage of CE offers just like this one, as well as other good education that's out there. But don't take my word for it. Don't take the word of the person who's teaching your continuing education class. Do the research yourself. One of the reasons we start these webinars with research literacy is so that you can become literate in the research. You can understand how to follow along. And absolutely, if you go through and you read some of these articles and you disagree with what I have to say, that's great. I absolutely welcome that dialogue, because there's so much out there and there's so many different ways to interpret it. And as a researcher, when I put my research hat on, I promise you, we will continue to update the science. The foundation will continue to support this. And you just need to come along with us and continue to update your practice along with us. So we'll give you the tools if you promise to join us and and really update your practice along with us.
Yep, and I'm sure that Dolly can speak on behalf of the CERT board that they'll continue to provide the education to keep us updated too, right?
Absolutely. We're always reviewing the approved providers and the content of their courses, making sure it's still relevant and it's up to date, and we're offering the most consistent and up-to-date information. And so we continually review the education that's out there.
It's great.
So what about home care? What do they do after they leave your table? What should we recommend?
Well, and when it comes to home care, it's really kind of interesting. In some cases, I actually pull research when I'm presenting different aspects of massage or manual therapy, depending on the context. Many times I pull the research from things like foam rolling and stretching. That type of research can really be applied to what we do. So don't forget that there's this relationship between that research as well as what we're doing with its effects, for example, on fascial manipulation and range of motion. Also, again, thinking about what I said about those shorter durations, that 5 to 6 minutes. So if you're sending a client home with home care instructions and you're saying, hey, let's get you foam rolling, make sure that you're giving them an approximate time. If they do it for a minute or 2 minutes, they might not be getting enough of an effect. But if they go for 20 minutes on one small area, it might be a little bit too much. So use the information that's out there to create some infographics or give some information to your clients so that you can really, really help them out. What I really like about this research is that much of it focuses on those shorter durations. And so we can really apply that and think about how that's working. And it typically focuses on one area, which isn't a bad thing because, again, when we massage, we're often gonna keep that area to be a little bit smaller. But especially when it talks about not being statistically significant, if we hear that p-value is not 0.05, hey, that's kind of our magic number from statistics, that much of what they look at when they talk about these modalities is related to a maximal exercise, and that's not what somebody is doing. So always really use that information to the best of your ability. So just because it doesn't improve a maximal exercise effort doesn't mean it won't be helpful a little bit later on. And then again, continue to use what you know about the anatomy and continue to know your stressors and your other good clinical skills.
I think that's a great recommendation, Portia, just because we all want to read massage research, but being multidisciplinary in terms of looking in different categories that overlap is very important. So I've encountered that a lot, especially in my teaching experience, that students are like, well, I looked up massage and this condition and I couldn't find it. And I'm like, well, what if you look under manual therapy? What if you look under stretching? And in the case of sports massage, why aren't you looking under exercise, or why aren't you looking under range of motion or something of that nature, as well as the sport itself, that if you're looking for a particular athlete. So those keywords or those search words are very important in being able to tie it all together. There's stuff out there. You just have to be patient and use a little bit of common sense in finding it, right?
And also, one of the things to look at is when you find a good article, scroll down to that reference section.
Yeah.
Look at who they're citing and see how many articles you can find. Especially, again, the articles that I pulled for this, I pulled systematic reviews and I pulled meta-analyses. So they're going to look at a lot of the different individual research articles that are out there. And what I love about those for presenting is it's not about one or two little points. And notice I tried to keep my reference numbers kind of short across the top. We don't need to have 6 or 7 people saying that if there's a larger study that really looked at multiple small studies. So definitely do that. Well, IJTMB, it's a great resource, absolutely. Use some other ones that are out there as well, and then help us build up IJTMB by doing your own research and submitting your own articles. So these are my list of references, and again, the handout is available to you, so please go ahead and take that and use those.
So we wanted to just kind of remind people about how you can earn 1 CE today. But first and foremost, I want to thank you, Portia, for presenting all this wonderful information, and thank you, Dolly, for doing this in partnership with us. To earn that 1 CE for today's webinar, you can go to the Massage Therapy Foundation's website, look underneath the resources and then webinar section. And also, you need to, if you want to earn that 1 CE, you do have to take the little quiz. And then once you take the quiz, then you'll be able to get your certificate of completion, and the foundation will send that out to you electronically.
So yes, can the CE from today be applied towards your board certification renewal? Absolutely. Portia, I want to thank you. Excellent presentation. I've been practicing for over 30 years and I still learn something new. Like you said, research is ongoing. And the people listening in, kudos to you, because you want to better yourself, your practice, and be the best you can for your clients. And so by getting this CE, by making the commitment, it just says a lot about yourself. And Portia, this was great information. So thank you.
Well, thank you. And I'm always glad to represent both organizations, the foundation, as well as NCBTMB. And because this CE is free, and normally you would have to spend a little bit of money, I'm hoping that some of our people who are registered, or some of the people who are even listening to this later on once we post this, I'm hoping that some of you are going to support Running for Research. They're going off for the Boston Marathon in less than 2 weeks.
Yep,
and
2 weeks.
So if you take maybe what it would cost to take a CE class, or maybe even a little bit less, maybe about $5 or $10, that you didn't have to pay for the CE, and maybe put it towards Running for Research, towards helping our researchers, then maybe Robin and Dolly can talk me into coming back another time. Besides,
in 5 years, when we go to figure out what else is going to happen. Yes, thank you, Portia, for the support for our Runners for Research. I also want to take a moment to thank our premium sponsor, AMTA, you know, just because they have been a huge supporter, but also for NCBTMB to be allowing us to do webinars like this and do it in such a timely fashion, right in the time of the marathon. We normally don't get to do this during this time of year. Usually the marathon runs in the spring, but because of the pandemic, this is the one that's been rescheduled. So, but yes, please support Sherry, Kelly, Rich, and Oliver. And I like to track them on race day. Race day is on October 11th, and there's actually an app that you can download on your phone, and you can put the names of the runners in, and you can track them on race day. And of course, if you want to go ahead and support them, the link to Give and Gain is right there for you. So we hope you will consider supporting our runners.
Well, and I'd like to piggyback on that too, because Portia, you said something really interesting, and I didn't realize how long the training was because I'm not a runner. But when you said these runners commit 20 weeks, 4 or 5 months, I think I can commit some dollars to supporting them. I mean, they're doing it for us. Research benefits all of us. So donate a massage or something, you know, what you would make from a 1-hour massage or whatever you can. Like Portia said, if it's only $5, if that's what you can afford, bless you, that's great. But if you can donate a 1-hour massage, what the money you would get from that, that would be awesome. So yeah, these runners are, what a commitment. I didn't realize that.
Yes, I've talked to them, I've met with them, and I have to tell you, I am not a runner myself, so I am in awe of this adventure that they take on. So, and we really couldn't be more pleased and proud of this group of runners. So we're very excited for them. So it's great weather too. We're hoping. So also, Dr. Resnick is a little remiss in not pointing out that she actually has done some research, as she said that you know, recovery and submaximal exercise is part of her wheelhouse of research. But the Massage Therapy Foundation, some of the resources that we provide, one of which is infographics. Well, our team is working on getting a couple of new infographics up on our website that is related to sports massage, and it should be available very soon on our website. both the review of the literature by Maraska et al., as well as the one by Dr. Resnick, the case study that was done. So those 2 infographics will be available for you very soon.
And those articles are available right on IJTMB's website. So you can, if you don't want to wait for the infographic and you want to try to get through the full article, you can definitely go ahead and do that. And I believe there still should be a podcast up as well about
That's right.
from my case study. So you can if you're not tired of listening to me yet, you can hear some more.
Well, you know, maybe the therapists that are listening to us today can go and read the research article, but then once the infographics are available, they can give them to their clients. So that way they can get more sports massages on their schedules.
That's awesome. How to find out more about NCB MTF webinars, please visit the website for the Massage Therapy Foundation. It's listed below, and there'll be information on upcoming webinars and how to access it. So please go to their website. It's listed on this slide.
Yep. I'm sure we'll have some more coming up very soon, Dolly.
Well, and how to connect with us. NCBTMB, you can go to our website, ncbtmb.org. We have an 800 phone number. You can also go to info@ncbtmb.org.
And to find the Massage Therapy Foundation, you can also go to our website, massagetherapyfoundation.org, but also the International Journal for Therapeutic Massage and Bodywork. You can go to ijtmb.org or also send an email to the info@ address on your screen, and we're easily reachable. I also want to thank our premier sponsor for this webinar today, Handspring Publishing. They have been generously sponsoring this webinar, but what's even great is that they are now offering a special discount of 15% off the list price of each book. So 15% off if you go to our website and go underneath webinars and scroll to the sports massage webinar for full offer details. It will give you how you can take advantage of that 15% off discount. So, and those are great books. Probably books you should have in your library if you're a sports massage therapist, right?
Absolutely.
So I guess we'd like to open up the field to some questions to see if anybody has some questions that maybe Dr. Resnick can answer, or Dolly or myself. Do we have any in the chat?
We do. I want to just cover a couple of housekeeping pieces first, because there are quite a few questions about links in the quiz. So I just want to cover that quickly. The website where the resources are available is, again, Massage Therapy Foundation /resources and webinars. You will find the link to the quiz there. You will also find all of the resources that we've discussed. A link to the quiz will also be sent to you in a follow-up email that will be sent about an hour after the event. You will have to copy and paste that link from the email. It doesn't allow us to hyperlink. So just a couple of pieces. If it seems broken, it's not. It might just be a little bit more work. We got several questions about that. So on to content, though. One of the questions we got, Portia or Robin or Dolly, how do we measure delayed onset muscle soreness other than just asking the client? Is there another way to do that?
Yes, there is, and I didn't want to get into the physiology of it. But there are quite a few different ways. Sometimes they'll do actual measurements, because with delayed onset muscle soreness, you're going to get some inflammation. So sometimes they'll do pre and post measurements, and sometimes they'll actually even examine pressures within the area. You actually have to, when you do that type of research, you actually have to put someone through maximal exercise to see if they develop the delayed onset muscle soreness. So it's very, very complicated. I wish I had a straightforward answer to you, but that's one of the reasons why I didn't cover it in the webinar.
That's like a whole nother webinar topic in and of itself, right?
And I don't think it would keep anybody's interest, but thank you for that question.
Before we get to another question, I just wanted to we just got a donation from Patricia while we were on the air here in the live webinar. So I want to thank Patricia. Thank you for your donation to the Massage Therapy Foundation. We truly appreciate it. So more questions, Monica?
Yes, another question is hydration a factor that's considered during research?
Hydration is usually a factor that is considered. And so many times what they'll do is they'll request that somebody comes in at a normal hydration level. If they're assessing people over multiple days, they'll usually take a body mass, so they'll weigh them beforehand in order to determine whether they're actually effectively hydrated. And we use from a research perspective, again, the research that I've done that have been cohort studies over time, we usually use weigh-ins like weekly or almost daily weigh-ins in order to make sure that somebody has returned to hydration status. I'm sure there's somebody out there that'll do other things such as urinalysis. I usually just go with body mass and body mass changes.
I never thought about doing that by actually weighing them. That's a good idea. So I do post-operative recovery massage. So a lot of times I do circumference measurements because I'm trying to look for it to go down. But would that also work to increase measurements too, Portia? Would that be a good way to detect it as well?
Yeah, and again, most of what I'm looking at is full body, not one particular area. So yeah, circumference measurements can definitely work. But when you're talking about athletes and you're talking about those hydration levels, I think that weighing them is probably going to be the best way in order to do that. We see that with some other research too, like concussion research. Are they dehydrated and things like that?
Yeah. Very good.
All right, and then more a comment I think that came through a couple of times, and I know all three of the panelists will support this, but to be sure to check scope and I think this started coming through when the self-care, or rather the home care slide came up on stretching and foam rolling specifically. I know those were mentioned. So obviously checking scope and getting the education that you need. And I know all three of you would support that. If there's anything more you'd like to say about that, I give you the opportunity.
Absolutely. I did not discuss, there are things like instrument-assisted soft tissue mobilization and cupping and some other things. And so absolutely. And again, we didn't talk about any particular technique whatsoever, really just talking about reading the research and seeing how that applies to what you're doing. Yeah. But thank you for always reminding us that.
Yeah, that's a good reminder. Always check your state regulations to see what your scope of practice is legally under the license that you have in the state that you practice in. That's always important, as well as if you have any other dual relationships or other certifications. So like in Dr. Resnick's perspective, she also is an athletic trainer as well as a massage therapist. So she has overlapping scopes of practice that allow her to do those things, but some of you may not. So, you need to make sure you keep that in mind. And if you don't have it, well, then, as we've suggested, go and get that continuing education credit and go get those extra trainings as advanced certifications. So that way you can add to your scope of practice.
And we have had a few comments about wanting to get involved in research studies, Portia, specifically with you. So certainly,
awesome.
Yeah, I think the panelists have all, I think the website, or I'm sorry, some email addresses are available. So if you're interested, any attendees in getting involved in research, let us know at those email addresses, excuse me, and we can certainly pass that on.
Yeah, well, actually, I can sort of wet your whistle a little bit about that with the foundation. We are launching a new project in the coming months. And so stay tuned, where people who are massage therapists that want to be involved in research, look for information about practice-based research networks that's coming up very soon. And you can be involved with that as well as our upcoming phase 2 of our ergonomics project, if that's something that wets your whistle. So
also, I want to say, Portia, I thought it was brilliant to use the pyramid, because that helps a non-researcher understand it even more and make us want to get involved. That was brilliant. That was really great. It helped us to understand the whole process better.
Thank you. And again, these webinars really are done for a particular purpose, and they really shouldn't be taken in isolation. So I'm glad to be able to have those previous resources. And again, if you haven't watched those, please look at the previous resources so that you kind of understand how that research is aligned.
Yep, absolutely. Any more comments or questions, Monica?
Because it's 1:59, I think we should probably close out, but I do appreciate everyone's comments and questions. And we can pass those on as well to panelists to get some additional information if we didn't get yours answered.
Absolutely. Well, again, I want to thank Portia and Dolly for joining us together again for another wonderful webinar with the NCBTMB and the Massage Therapy Foundation. Thank you again for joining us, and we hope you have a wonderful fall and a great season of sports. You sports massage therapists out there, we'll see you soon.
Bye.
Bye.